Greetings and welcome, all the listeners, to our latest episode of the Health Tech podcast series. Today's session will help you traverse through several exciting topics with our guest, Dr. Sandhya Ahuja, a dynamic and effective senior consultant in data management, analysis, and health management information system for over 30 years in progressive leadership roles. I express my heartfelt gratitude for being our guest, and I welcome you to our Health Tech podcast series. Today, we
Thank,
have the opportunity to draw an ounce from the reservoir of your knowledge and experience. First of all, I would request you, ma'am, to share what do you think of the podcast and how do you feel about joining us today?
First of all, let me thank you for inviting me.
It's a
And
privilege to host you, ma'am.
yeah, I have listened to lots of podcasts, but this is the first time I'm hearing. So, since maybe I'm a bit nervous.
No, ma'am, it will be just all right.
So let's hope. I mean, something I can say something useful for everybody.
Yes, ma'am. So we have a few set of questions that we would love if you would answer for our audience.
Hmm.
So starting with, we have a question for you that says that being a health expert, you must have a pretty busy schedule. So what does a normal working day in your normal life looks like, and what part do you like the most about your job?
Uh, See, at the moment, I'm doing just consultancies.
Yes,
I'm,
ma'am.
so my job, I usually start working after my breakfast,
Yes.
and I set a target that I have to finish this much. I have to finish, this much work today. So I try to finish it by 5 o'clock, or otherwise I may extend my hours also, depending on whether I have achieved that much or not. And then I have my normal life, you know.
That's a pretty interesting and busy schedule, I must say, that you have,
Mhm.
ma'am.
Yes,
So,
I am quite a bit organized. I have organized my personal life with my,
yes,
work
ma'am,
life.
that's a great quality we all must learn.
Hmm.
So, you have a very active engagement with the people through social media. Do you feel that the advent of social media today has made it much easier to spread awareness, particularly
Oh,
in health cognizance?
oh yeah, yeah, very much. There are lots. First of all, I learned lots of things from social media. Like about COVID. You know, I didn't know anything, but then I saw some articles, somebody sharing their experiences, and then I learned, a lot, and I started working on COVID and other infectious disease. Nowadays, we have this flu and bird flu and other flus, and whatever uh, I've done myself, I've shared with the social media. Lots of people have asked me lots of questions, and which they didn't know. And then I met people of same, interest, and then we started sharing things. We started our own WhatsApp group, and it's been a very very useful for me, at least, because it's a rather, I've been in touch with the friends as well. But
Yeah,
beside that, it's a learning platforms for me, this social media.
yes, ma'am, that's so true.
Mhm.
So, you have been a part of the medical industries for over 30 years now, and you must have seen a lots of ups and downs in the field. So, at present, what advancements would you like to see in the Indian medical system?
See, Indian medical system needs a lot of improvements. I mean, digitally it has improved a lot, and lots of infrastructure has improved. But first problem is accessibility, especially in the rural areas. Doctors are not available. There aren't people can't reach. It's like they have to take boat sometimes, and especially if there is a pregnant woman, if she's going for delivery. So big. I think, I mean, there are lots of vacancies, also doctors' vacancies in
Yes.
most of the infrastructure, especially the specialists. And we are far away from that WHO's criteria. There should be one doctor per thousand population and all. So these things need to be improved. I mean, digitally we are doing very good, but
Yes.
these are the things we need. A shortage of doctors, improvement in infrastructure, uh, lots of things.
In how many years do you think these changes can be implemented in India?
See, it depends on the person in charge. If he
Yeah.
is interested, he will get it done, in no time with certain ideas. You have to get certain innovative ideas and other things, policies. Otherwise, if you are not interested, you can carry on for years and years. No problem.
Yeah, I agree, ma'am.
Yeah.
That's very well said.
Mm.
So, if we see the current scenario right now in the job market, so data science job opportunities are flooding in India because organizations seek to harness the power of data to drive decision making. But
Mm.
how was it different back then in the initial phase of your career? And how did you decide that time that you have to pursue in this field?
Uh, See, when I joined Janani in Patna, that is the first time I started working on data, actual
Okay.
data. But because it was a NGO, so they had their own system of getting the data, for social marketing or for clinical this thing. So I analyzed that. But when I came to Delhi, when I joined NHSRC, that was the time when the government started thinking that it is important we should have data warehouse. Initially, people had to send a request in writing to get the data, and it used to take a lot of time, and sometimes um, all the data are not recorded also, or not recorded and not reported. So NHSRC took great, I mean, along with the Ministry of Health, we started, what are the data which are required, how will be collected, how they should be registered for recording this, how they should be reported, what are the indicators and all. So now things are much, much better than what it used to be.
Yes,
Like
ma'am.
we used to have a data like general category, SC, ST, and all those. It was decided we really don't need what they were doing when the data was reported. They had this census percentage, like 10% is SC, 10% are or 12% are SC. So what would they would have of the total? They will do that calculation, and
Yeah.
they will So it was decided that at the central level we don't need, but at the village level, this health workers will collect that. They know it's the house, and if
Yeah.
anybody needs it, that can be collected from there. Yeah.
All right. That was a
Mm.
great answer, ma'am, I must say. So, being in the industry, you have taken up several leadership roles. Could you share with us how did you develop your leadership skills and what advice do you have for others who want to become an effective leader like you?
See, first thing is, I mean, to me, leadership doesn't mean bossism.
Yeah.
You don't have to be boss. You have
Yes.
to be at the equal level. You have to work as a team leader. And whatever I've learned from my seniors. My
Yeah.
senior first ED of NHSRC was Dr. Sundaraman, T. Sundaraman. He was a very learned person in public health. So he was full of knowledge, and he would, he loved teaching people, that
Yes.
you should do this and that. Then there was Dr. Sanjeev Kumar. he was not only ED there, but he treated us like a family. You know, he never behaved that he's a boss, but he thought we are family. Even got involved in our personal problems also. If anybody got sick or any other problem, he would personally take initiative and help us. That was another. And third was Dr. Rajni Ved. She was our ED, and now she is with Bills and Matilda. She was boss when she is, when something needed to be done, and she was,
Yes.
but she was so friendly. She treated us like friends and took her to her house for lunch, and every. So we used to have a lot of fun. So I learned these things that leadership doesn't mean you have to be boss. You have to be at level of them. You also
Yes.
learn from them. There are so many things you can learn from younger generation also.
Yeah.
And this is, I never felt like a leader. I always felt like I am with them, and whenever they need anything, I am there to help them. Teach them whatever they wanted, and we used to have fun. We would go after we have finished some project. We'll go out for lunch or in a team. That is my definition of leadership.
Yeah. So basically, like leadership is not about titles, positions. It's like the
No.
relationship we maintain with our juniors and seniors, right?
Yeah, yeah, you have to encourage them. You
Yeah.
don't have to tell, oh, you don't know anything. No, if you don't know, if he or she doesn't know, sit down with the person and make him or her explain. Make him understand that what you want. That is what I feel. That is what is leadership. If you can you know,
I've noted
make
down
your
all the points.
juniors, sorry, if
Yeah.
you can make your juniors what you want to the person or the junior to do for you, that is what it
Yes, ma'am.
is.
So with the next question, ma'am, everyone in the life have their own twists and turns, right? So for you, what has been a major incident that has been a turning point for you, or any setback that you had a hard time dealing with in your career?
Uh, I When I was in UK, I was working for nuclear industry. I was a mathematical modeler, modeling nuclear reactor, and I was even offered a Justice of Peace offer from Crown Court here, near Manchester. My husband was a doctor, medical
Okay.
doctor, and then he changed his mind. He said he wanted to go back to India because he is from India. Whatever he is today is because of India, so he wanted to serve India.
Okay.
So that was something, when you're fully settled and everything, and you have to leave everything and go.
Yeah.
So when I went there, then we had some family problem. Then my husband had to come back, and he couldn't cope with so much of stress. So he had heart attack,
Oh.
and we lost him. And then I had two children, young children that time, 11 and 12 years. So that was something, that I decided that I have to live for my children. And that was my main motive, that I have to give them education, get them educated. And because nothing, I never thought of anything else. I say education is very important. If you have education, you will never be a loser in your life. You're educated. So are both settled. My son is in Australia, doing very good director in a bank. My daughter is in UK doing yes, she's a software engineer, computer engineer. In fact, still doing some studies from Manchester University. So
Okay.
those are the setbacks, but I moved ahead. I moved ahead. I had to do for the
We
sake
have
of
no
my
choice.
kids.
Right. Yes. That's truly inspiring to hear that from you, ma'am.
Okay.
So,
When it
you
falls on
joined.
you, I must say, God has been very kind with me. If one door was closed, he opened other door for me. So with the blessings of God only I could, get all this achievement. And best thing is that my both children are good human beings. That is
Yes.
the best achievement of my life, that they are both are very good human beings.
So, ma'am, the majority of our podcast listeners are actually college students. So, if someone is just starting out in your field or pursuing a similar passion as yours, how should they start working towards this goal and what path should they follow?
See, first of all, they have to understand what is data, what is indicator, how that can be, I mean, how data can be converted into information. What are the drawbacks? What could be the problem in collecting data? How to collect data? That is very, to know the subject is very important,
Yes, ma'am.
and that is a thorough study. Actually, thoroughly you have to know. It's not that how do you how do you go to field, how do you collect data, how it should be recorded, how it should be reported, and all those are very important aspects of data. Then analyzing is something. First you have to understand what is your goal or what do you want to get, then accordingly you analyze the data, what to
Yes.
achieve. So for me, it is important. I mean, for me, I would suggest to the students understand the subject, because different. If it is a hospital data, then it has a different meaning. If it is a public health data, then it is a different meaning. Like hospitals have their own goal. Public health has got its own whole goal, like they want to reduce IMR, they want to reduce MMR, they want to achieve some goals. Okay. Some goal like they want to eradicate the TB and all those things. So you have to know the subject. It is
Okay,
to
ma'am.
know your subject, and you know, for like indicator, you need two types of data, one numerator and one denominator. Then it has to be either ratio or it can be percentage, depending on like the
Okay.
yeah.
So, first step should be like researching about what your really goal is and then work towards it. Am I right, ma'am?
And yeah, and one very most important thing is know the source of data. From
Okay.
where you, that is so important. I have seen cases where, you know for any research work or for any policy, they say, we'll do this, we'll do that, without realizing from where you will get this data. There is no source for such data. So you have
Okay.
to first find out what are the sources, are they reliable or not. All sources are not reliable. You have to
Yeah.
understand that. You have to study how this data is collected, how it is extrapolated to make it for the general population and all the. So source is very important, because I've seen many people don't know what are the source, where these are available and all those things. That is very important.
Okay, ma'am. That was a great answer. I'm sure it would help our audience to
I
deal
hope
with
so.
this.
I
Yeah,
am always there if you need any help. I'm always there. And you can just send me a
that's so,
message or with a question. I can over. You can even ring me if you have any questions.
that's so great of you, ma'am.
Welcome.
So, if you had to name the top two qualities that someone needs to be successful in your line of work, what would you name them?
Commitment to your work. You should be fully committed.
Yes,
And
ma'am.
second is, for me, it has been very important to meet the deadlines. You have to meet your deadline, even if you have to work beyond your office hours, even if you have to work throughout your night, but never miss your deadlines.
Deadlines are actually a great motivator.
Yeah. The person who needs your work, he cannot wait for your, if he wants to finish it on this date, you have to cooperate and,
Yes, ma'am.
you
So
should
with this,
answer. Yeah, sorry.
no, it's ma'am. Please continue.
No, no, it's all right.
Okay. So, with this, I would like to conclude my questions, and I thank you, Dr. Sandhya, for sharing your precious time and expertise with us. Your insights and stories were incredibly valuable, and we appreciate your willingness to join us on the show. I request you to share anything with the audience that you would like to, or I might have missed asking you.
Enjoy your work. Always enjoy your work. I have always enjoyed my work. That's why even now I'm enjoying. So
Yeah,
enjoy
that's it.
your work. And job satisfaction is of course very important. But yes, enjoy. Whatever you do, you should enjoy it.
Yeah, that's a great advice, ma'am. So, before we wrap up today's episode, I want to thank each and every one of you for tuning in. Your support means the world to us, and we couldn't do this without you. We are grateful
Thank
for your feedback, your shares, and your continued enthusiasm for our podcast. We can't wait to bring you more great content in the future, and we are excited to have you along for the ride. If you have enjoyed today's episode, we would love if you would subscribe to our podcast. Thank you to all the audience who were listening to this podcast, and thank you, ma'am.